This is Gene Krebs.
Hi there. Oh.
And we're high on Ohio.
Hi, this is Gene Krebs, and I'm a senior fellow at the Center for Community Solutions, where we think it's about time we have a conversation in Ohio about our mental health problems and how we are addressing them or not addressing them. May is Mental Health Month, and this issue affects all of us, and we'd like to spend a few minutes discussing it with you, interviewing some leaders from around the state, and looking to see what can be done. First, let me share with you that mental health or drug addiction can occur in any family. It doesn't matter what your zip code is or what your checkbook looks like. It cuts across all lines in this state and affects us all personally in ways that we know about and in ways we cannot imagine about. For myself personally, it's impacted me. I have, or rather had, a sister who committed suicide in a rather gruesome and awful manner. And we're still living with that miasma of guilt. How we handle it and how other citizens in the state of Ohio handle this issue is the topic of today's conversation. Ohio's mental health system only provides treatment to about a quarter of those with mental health issues.
Dave Royer joined the Alcohol, Drug, and Mental Health Board of Franklin County as the Chief Executive Officer in May of 2000. Listen to what he has to say about the growing scope and awareness of mental health issues in Ohio.
I think it's just the size and the scope of these horrible tragedies. Has just, you know...
Bobby and Betty Buckeye, something's triggered with them, and they're just...
Absolutely. They're starting to say, what's wrong?
Yeah.
What, you know, and unfortunately, they continue to occur throughout the country.
Advocates for those impacted by mental health problems have been making their voices heard for decades, over the course of which there have been societal shifts in awareness and acceptance. Joan Anglin is the Executive Director of the Mental Health Advocacy Coalition.
I think what there is, Gene, is there is a growing recognition.
This is a driver.
Right, for a couple of reasons.
Right.
I think people are becoming more comfortable talking about the fact that either they or someone they know has a mental illness or addiction disorder.
Here again is David Royer.
I think the other thing, too, is that it's part of the 24-hour news cycle we live in. That there are events that occur all over this country every day that 25 years ago, even you and I back, you know, we would not have known about. So I think there's a heightened awareness, but I also think that there's a growing appreciation and understanding that there's been too much bifurcation between our emotional well-being and our physical well-being. And I think this idea of how do you bring these things together in a more integrated manner, I think it resonates with common sense. That the more we start to understand that our emotional well-being affects our physical well-being and vice versa, that's helping to promote awareness about mental health and the importance of mental health care.
Joan Anglin.
I personally think that part of that is due to women who a number of years ago began to talk about postpartum depression. It was acceptable to talk about postpartum depression. And as a result of that, there were some open conversations. I think the next step then became depression. People began to talk about depression. It was acceptable. It was more acceptable. We're now moving to the point where we're talking about bipolar disorder or bipolar depression, I've heard it being called. I think we are, I hope we are on a track moving forward where it's becoming increasingly acceptable to talk about that, and soon we will get that way, I hope, in regard to addiction disorders.
This current state of affairs is costing us dearly, not just from a human standpoint, but from the impact on public systems. Eve Stratton left her position as Associate Justice on the Ohio Supreme Court in large part to work on this issue, and is now a lawyer at Voorhees, Sater, Seymour, and Pease.
10 to 15% of the most seriously mentally ill consume about 70% of the resources because they're picked up, they take shelter space, they take emergency room space. taking care of somebody in a supportive housing environment where you support them with housing costs us about $50 a day. $30 a day. A jail or prison bed costs about $60 to $80 a day. A hospital bed costs $1,500 a day. So when they're picked up and put into a hospital for 2 or 3 days, you can imagine you can keep them for a long time in a supportive housing.
Terry Russell is the executive director of the National Alliance on Mental Illness of Ohio, commonly called NAMI.
If they're not treated, they will impact society forever in their lives. If it's revolving from one place to one place, the cost is horrendous. It right now costs $1,600 to be in a private psychiatric hospital. It costs $1,600 a day. And it costs $700 in a state hospital.
Okay.
It's ridiculous.
So who designed this system? Susan Ackerman is the Troy Hoff Chair of Health Planning at the Center for Community Solutions. Here she comments on the vast changes in the delivery and finance of mental health services that occurred over the past 20 to 40 years as state hospitals closed in favor of community-based services.
You know, we stopped doing one thing. We planned to do another thing, but we didn't really build up the system the way we had intended, and so then we ended up with the system that we have. And this isn't a problem unique to Ohio. This is a problem that is consistent across the United States.
How badly designed is the system, and how badly is it working? One of the biggest problems is the role now prisons have come to play. In the wake of an incomplete transition from the large state mental hospitals of the past, growing numbers of people with mental health issues and alcohol and drug addictions have become reinstitutionalized in a growing prison population.
Jails are, unlike prisons who know when you're going to be released and have time to plan for that, jails have mostly people there who are what we call pretrial, means it's before case disposition. So people come and go from jails in a very unpredictable and hectic way.
I never knew that.
Yes, and that's one of the challenges of working what we call discharge planning, like trying to plan for the release of somebody from jail, is that they can go at any time. A case can be dropped, the judge can resolve a case at any given hearing, they can get bail, right? So there's a number of reasons. So it's very hard to plan for the exact moment when somebody's going to be released. And the other thing that's true about both jails and prisons, but it's more extreme in jails, is that you leave jail with exactly what you came in with. And so I'm going to be blunt for a moment. And I'm going to tell you that if you got picked up on the street and you happen to say, for whatever reason, have in some way urinated or vomited on your clothing, they will be bagged. They will be waiting for you unlaundered in most cases when you leave, because that's not the jail's mandate. They bag your possessions and they save them for you. They inventory them and they give you back exactly what you had.
Is there progress being made? In part. Mental health courts have made a big difference in the few Ohio counties and cities that have them. Here again is former Justice Eve Stratton.
The judge is like a team leader, brings in mental health, brings in drug and health, brings in the housing, and said, okay, the first thing we got to do is get this person a house. We got to get them shelter, because if we don't, they're going to end up back under the bridge. Doesn't matter how much mental health treatment we give them. And they treat it as a team, and they support this person with what they need to succeed. And it's not a soft on crime, it's a smart on crime, because they have to be in this program for usually 2 years, whereas they could serve their 3 weeks, be out back on the street.
Some people may wonder why we just don't bring back the old state mental hospitals. Besides the enormous costs of institutional care alluded to by Justice Stratton, there is a question of efficacy for the consumer or client. Dr. Wilson.
Ohio has one of the most active state hospital systems I have seen in the states that I've worked in that you can be actively still admitted from the front door, where most systems, you don't get into the, if there are state hospitals, you don't get into
So we're
them.
doing that fairly decently here then?
Well, it depends how you see it. From a consumer perspective, there's a big move to get rid of these institutions and create humane treatment centers that are more community-based.
But the problem we have with community-based is we have a thing called local zoning. Right. And the moment, this is the thing I'm coming to understand with this whole debate, is that people may talk about we need to deinstitutionalize, get them out in the community, but in Ohio, we worship at the altar of local control. And you immediately run headfirst into this brick wall called exclusionary zoning, where the local citizens say, we don't want those people living in our community. And because they are local, they have local zoning laws, they vote, they can almost always kill any initiative.
Considering the combination of deinstitutionalization, incomplete execution of plans for community-based services, sentencing laws that led to an explosion of prison populations, and Ohio's tradition of local control, it should be no surprise that housing has become a major challenge for people with chronic mental illness. It is one that is likely to dominate policy discussions during the years ahead. If the experience of the past several decades teaches us anything, it's that the challenges are complex. Dr. Wilson.
I don't know how many people maybe have thought about this, or we've heard this, that jails have become the new state hospitals. This is a very common thing. And it is very true that there are a lot of people with serious mental illness in jails and prisons. That's true. But the reason why is what I want to challenge. And it's people will bring out charts. They'll say, see, the number of people in state hospitals have gone this way, and the number of people in jails and prison have gone this way. It's a direct relationship. As we have people leaving the state hospitals, they're going directly into jails and prisons. But actually, the data does not bear that out. And there's two reasons. One is there was this other thing happening when the people with serious mental illness, the numbers started to rise. It was during a time where the number of people we incarcerated skyrocketed. It went fourfold. It went in from a couple 100,000 into the millions. So we were incarcerating a lot of people. And so people argue, the question then becomes, are people with mental illness being incarcerated because they're mentally ill or because they share many characteristics in common with people who get incarcerated generally, like poverty, substance use, homelessness, right? Now, the second piece of this is, and it's a puzzle, we can never prove it. People have spent years trying to see what the rate of incarceration was before deinstitutionalization, meaning before we started to close the state hospitals, and after. But the bottom line is we'll never have the data to answer that question. We don't know. We don't know the rate. We know that people with mental illness have always been in prisons and jails. We just don't know the rate.
Complicating things even further, the housing dilemma for people with mental illness is occurring against the backdrop of societal housing issues writ large. Here again is Community Solutions' Susan Ackerman.
Not only is it a problem for individuals with mental illness, it's a problem for just poor people in general. By and large, we are increasingly
Economic demographic segregation. We are segregating ourselves tremendously.
and that has huge implications, you know, across all of society.
So, how should we approach the housing challenge for the mentally ill? Here again is Dr. Wilson.
What a lot of community providers have done is gone to scatter site housing.
Okay.
And the idea behind that is instead of building one group home, if you will, most people I think understand what a group home is, right? You basically rent market rate apartments and you place people throughout the community in apartments.
Unobtrusive manner.
Mm-hmm. And scatter site housing is by the way, it gets around most zoning problems, and I would argue it normalizes the lives of people living there because they're much more integrated into the community. But once again, it's still done in a thoughtful, planful way with services wrapped around the person, some monitoring, some supervision, and support.
It seems pretty clear that housing will be a high priority in the near future, but it is just one of the numerous challenges to our mental health, alcohol, and drug addiction services system. Consider a few statistics.
Serious mental illnesses cost Americans $200 billion last year in lost wages and earnings. In Ohio, we have 400,000 adults and 125,000 children who are living every day with severe mental illness. 60% of adults and about half the youth received no support for their mental health issues last year. May is Mental Health Month in Ohio. And we at the Center for Community Solutions thank you for watching, but we also now want to ask you this question: where do we go from here? I'm Gene Krebs, and thank you for tuning in.
For more about the Center for Community Solutions or their publications, please visit www.communitysolutions.com.